So at the outset, I would like to thank Dr. Bansi Sabu sir for giving me this opportunity. Uh, this topic was supposed to speak by Bansi sir himself only, but last time my confirmation, though he gave me this topic. So let's diabetes-free generation, hope and scope. Imagine a world where children grow up without the shadow of diabetes looming over their lives. So we know that it's a global pandemic everywhere, and in last few years it's rising and rising and rising. We know that type 1 and type 2. In type 1 it's definitely insulin deficiency dependent patients. In type 2 the insulin is present is there, but the cells fail to respond properly to the insulin, and because of there is a lifestyle factors which like obesity and unhealthy diet, making it largely preventable through the lifestyle modification. This is the rising trend. You can see that in young children or young adults, both type 1 and type 2 is rising exponentially. The burden of diabetes at the economic cost and social impact, the individuals, including families and the healthcare system, and the cost associated with the diabetes care, including the medications, the supply hospitalizations, long-term complications, and staggering investing in diabetes prevention can significantly reduce these costs, and they have a profound social impact on individuals and the families. Children with diabetes may face challenges in school, sports, and the social activities. The chronic nature of this disease can lead to stress, anxiety, depression. Support and understanding are essential to mitigate these challenges. The genetic predisposition, as we know that having a family history of type 2 diabetes or some type 1 diabetes, there is increased risk in the developing of this dreaded disease. There are some genetic variations have been linked to both type 1 and type 2. However, it's not genes alone, but the environmental factors also play a crucial role, and researchers have found out that there are some gene genetic variations or genes are linked with the type 1 diabetes who are at risk, and they may be benefit from early prevention and diagnosis of them. So need to fully understand this complex interplay between the genes and the diabetes. Environmental factors, the diet is a very important. Unhealthy diets can increase the risk of type 2 diabetes, and there are some environmental toxins which can contribute to the development of diabetes. So the pivotal role in early detection by the early screening through the programs in the targeted population, lifestyle changes such as diet and exercise, which can significantly reduce the diabetes risk. And the technology in advance nowadays, we are seeing that CGMs and the insulin pumps are better for the diabetes outcome. The screening programs at the risk for children, we have to target the population whom they develop the diabetes, such as a family history of diabetes, the obesity, or some ethnic backgrounds. So early identification of these individuals allow for timely intervention and the prevention efforts, and these are very cost effective screening programs. In long term, we see that these programs can involve the children who are at risk. In long term, if they will go for a screening programs of the children in schools or in other areas, we can find out the susceptible population who will develop the diabetes, then we can stop the diabetes prevention. The lifestyle intervention, healthy diet is a cornerstone in prevention. We should encourage our children to consumption of fruits, vegetables, whole grains and lean proteins, and we should limit the sugary drinks, processed food and saturated fats, and of course educate the families on healthy meal planning and the preparations. And regular exercise, at least 60 minutes of moderate to vigorous exercise in each for each and every children, so they can make exercise fun and engaging to promote long term adherence regarding the exercise. The role of education in diabetes prevention, we know that knowledge is a power, and educating the children and their families about the accurate information of diabetes and their risk factors, prevention strategies, and the healthy lifestyle choices, we can empower them to make informed decision and take control of their health. So the early education can instill healthy habits for the life. And of course the community programs and schools and healthcare settings, these programs should be tailored to the specific needs and cultural background of the target audience. Collaboration should be made between the professionals, the educators, and the community leaders is essential for successful implementations. Regarding the technology, the telemedicine, insulin pump, and CGMS are now the cornerstone on type 1 and type 2 diabetes. The CGMS, they gives you the real-time glucose reading throughout the day and night, and allowing individuals with the diabetes to track their blood sugar levels and make informed decision about their insulin doses, diet, and the physical activity. In these CGMs, there are alerts which can notify the patient about their readings, whether they are going into the hypo and the hyper. So by these CGMS system, the better outcome of diabetes. Insulin pumps, they precise delivery continues through the day, and they mimicking way of a healthy functions, pancreatic functions, and they can be programmed to deliver the insulin at a constant rate and a bolus insulin at meal times or when blood sugars levels are high. Nowadays they can be automated with the CGMS also, so automatically adjust insulin delivery based on real-time glucose readings, and they significantly improve glycemic control and reduce the burden of diabetes management. Telemedicine and remote monitoring, nowadays it's a very good for a chronic diseases including the diabetes. So the healthcare professional can provide the remote care and education to their patient and improve the access to care and reducing the needs for in-person visits, and they are particularly beneficial for individuals who are living in the rural areas and who are with the limited mobility, like in a diabetic foot, or if they are amputated patients and because of diabetes. So that these remote monitoring technologies also track their patients blood sugar levels, insulin doses, and other health data remotely, allowing them to identify potential problems early and intervene proactively. So all these will improve your diabetes outcome. The research areas in diabetes nowadays, first is immunotherapy. By that you can prevent or reverse the autoimmune destruction of insulin producing cells in type 1 diabetes, and this approach holds promise for preventing the onset of type 1 diabetes in at risk individual or potentially curing the disease. Second is the stem cell therapy, which involve using to regenerate the insulin producing cells in the pancreas, and this approach could potentially restore insulin production in individuals in both type 1 and type 2. And gene therapy, they are aims to correct the genetic defects that contribute to diabetes, and they are holds a promise for preventing and curing both type 1 and type 2 diabetes, and they are now a frontier of research in field of diabetes. The immunomodulation for type 1, the system prevent it from attacking insulin producing cells, and strategies include the immunosuppressive drugs or stimulating regulatory cells. There are few clinical trials we are focusing on this area. The stem cells holds a great promise for treating diabetes by replacing the damaged or destroyed insulin producing cells in the pancreas. The stem cells have a unique ability to differentiate between into the various cell type like insulin producing beta cells. The scientists are exploring different approaches for a stem cell for diabetes, including transplanting the stem cell derived beta cell into the pancreas and stimulating the body's own stem cell to regenerate the beta cells. Now in Japan one is going on. The gene therapy, basically they are for correcting the defect in genes which are contributing to the disease, and they have explored different gene therapy for diabetes, including delivering the genes that promote the insulin production and improve insulin sensitivity or protect the insulin producing cells from the destruction. This is the future in type 1 diabetes also. The impact of health public health initiatives. The public health initiatives plays a critical role in preventing diabetes by promoting healthy lifestyles, raising awareness about the diabetes risk factors, and provide access to the screening and prevention services. So that's why through these health programs we focus on early detection of diabetes through the screening programs and awareness campaigns. The Indian government is running a national diabetes prevention program, and on that evidence-based programs, they aim to prevent the type 2 diabetes in individuals at a high risk of developing the disease. And these programs typically involve lifestyle interventions such as diet and exercise, counseling, and delivering in group settings. And they have proved the results that by this NPPD program, even 58% reduction in developing diabetes have been seen by this national program by the Indian government. School-based intervention for healthy eating, it is a cornerstone. In nowadays in schools, we know that the mostly children are in day boarding schools, and if school can play in these eating habits by providing healthy meals and snacks, implementing the nutrition education programs, and creative this supportive social school environment that encourage the healthy choices. And in school based interventions include the school gardens nowadays, cooking classes and nutrition education program. They can help children learn about the healthy foods and developing cooking skills and make informed food choice. Education at young age leads to the lifetime fitness. Community-based awareness campaigns can help again raise awareness about the risk factors, prevention strategies, and the available resources, and they should be tailored to the specific needs and cultural background of the targeted community. And this will lead to early detection and the treatment. And through the social media or the community events and the local media outlet to reach a wider audience, and we should collaborate between the healthcare professionals, the community leaders and the local organization, which is essential for successful implementation. Bring this message to the people that the awareness programs are much needed for the early detection and prevention of diabetes. Importance of family involvement. Family plays a pivotal role in providing the support, encouragement, and guidance to help their children to adopt healthy habits and manage their diabetes effectively. Families also can create a supportive home environment that promotes healthy choice and which can reduce the stress. These are again parental groups and support groups. They focus on the particular population or their children's about the diabetes prevention and healthy meal planning and coping strategies. Creating a supportive home environment at home by the families, and they can provide the healthy habits among children, and this includes the healthy meals and snacks, encouraging the physical activity, and the most important is the limiting the screen time in the children's. And there should be an open communication between the other families, and they can create a support group also, that one family can ask the another family about the diabetes prevention, and emotional support group should be there. Psychological well-being is an important aspect of diabetes management. The children who are at diabetes may have an increased risk of developing anxiety, depression, and other mental health problems, and then they can affect the management of diabetes and overall health of that children. So that is why the mental health problems and provide appropriate support and treatment to these children. How we should screen the children who are at the risk of anxiety, depression, and eating disorders, and early identification of those children and timely intervention and treatment, we can treat these children. No children should suffer in the silence. Counseling is a cornerstone for any mental or psychosocial well-being, and the cognitive behavioral therapy can effective in treating these anxiety and the depressions. There is a stigma also available in the families that diabetes is something wrong, but about these education, the diabetes, we can remove the stigma in the families. There should be some support group and peer mentor programs so that we can help reduce this stigma by providing a safe and supportive environment for individuals to share their experience and connect with others who understand that what they are going through. There is no shame in diabetes. Healthcare professional, of course, in treating and early prevention of complications, we are always there. The healthcare can educate more properly to the children and families about their management. They can give them the healthy eating habits, the physical activity and coping strategies. We know that being a HCP care, the prevention and early detection of complications are more important with us also, and then by giving the education about these diabetes, we can have a very big role in health this diabetes. To empower their children, that essential promoting self-management skills, independence and psychological well-being. They should feel empowered that they are more likely to take control of their diabetes and make healthy choices. With great power comes with the great responsibility. fostering self-management skills, that we should tell every children or the every diabetic patient that you should manage yourself about regarding your diabetes, your blood sugars, your health plans, your exercise and everything. And by giving encouragement, guidance and supportive home environment, it is important to find the right mix of providing help while fostering independence. So building a diabetes free future, this is now time to call action. The prevention diabetes in children requires complete effort from the individuals, families, healthcare professionals, educators, community leaders and policymakers. By working together, we can create a healthier future of our children and generations to come. It takes a word. Education this presentation serves as a call to action for all stakeholders to prioritize diabetes prevention effort and invest in programs that promote healthy lifestyle, raise awareness and improve access to the care. This time is to act now. Time is hope is now. So thank you everyone for your patience hearing.